right. It's another day where we are alive and so is public health. Welcome to Better Together. I'm Jonathan Lile-Sexton. You may have noticed we've been doing some rearranging of our set, and today we're talking about housing. It's a place to live, a roof, four walls, most basic human need after food and water, and obviously the ability to complain about the food and water we have. And yet somehow we have made it extraordinarily complicated to obtain. I recently saw a Barbie dream house listed for rent on Facebook Marketplace, $1,500 a month. Accessories not included, which is bold because at that price, I at least expected a tiny purple mailbox and an emotionally available Ken. But that's kind of where we are, because housing in America right now is, as the youth say, completely cooked, fam. And look, the listings aren't helping. Real estate has started using the word cozy so frequently it has lost all meaning. It now means one room, no closet, the upstairs neighbor having strong opinions at 6 a.m., and every morning you paying dearly for those opinions. So I think it's time for a pulse check. Nationally, the data is very clear. About 70% of Americans say housing costs are a major problem right now. Nearly 1 in 3 households are cost burden or spending 30% or more of their income just to have a place to sleep. Renters, half of renters are cost burden. The other half are one increase away from joining them. It's a real fun system that's firing on all cylinders. Almost half of Americans say housing costs are actively putting their lives on hold. It's delaying starting families, careers, entire futures. That is not a housing crisis. That is a life crisis with a housing-shaped entry point. And here's the part that trips people up. When most of us picture a housing problem, we picture the extremes. You're either housed or you're unhoused. The lights are on or they're off. But that's not how this actually works. Housing is a continuum. On one end, you have stable home ownership. On the other, homelessness. But in the enormous, murky middle, you've got housing that is workforce, you've got subsidized units, you've got vouchers, you've got people doubling up with family, and people one rent increase away from losing everything. People are always having to make impossible trade-offs every month just to stay somewhere in the neighborhood of okay. See, that middle is where most of the tension lives, and is also where the most solutions need to happen. So why is it so hard to fix? First problem, the help exists, but accessing it is a part-time job. Programs like housing vouchers and supportive housing programs are genuinely powerful tools. There are also bureaucratic mazes with eligibility requirements, limited funding, and waitlists so long that by the time your name comes up, your situation may have changed entirely. We've built a system where the people who need the most support are also expected to have the most capacity to navigate complicated paperwork, which, if you think about it for more than 3 seconds, insane. Second problem, we simply don't have enough units, and building more housing is not fast, cheap, or the fun one, politically simple. Because here's the math that makes no sense and also perfect sense at the same exact time. It is way more profitable right now to build a luxury lakefront property for seasonal residents, the people who come up 6 times a year and describe it as their little escape, than a starter home for this teacher at your kid's elementary school. So the more profitable one is what gets built. Supplies stay low, demand doesn't. And your local kindergarten teacher is commuting 40 minutes because they can't afford to live in the town where they work. Third problem, housing doesn't exist in a vacuum. It's tangled up with income, transportation, healthcare, mental health, substance use, and employment, which means when someone is struggling with housing, it's rarely just a housing problem. It's a whole pile of problems that housing happens to be sitting on top of. So this is where organizations like Community Action Program come in. Because sometimes the difference between stability and crisis isn't one dramatic intervention. It's a series of small, well-timed supports that keep someone from falling through the cracks we built in the floor ourselves. Here's the thing about housing that's easy to forget when we're talking about policy and supply chains and tax credits. When housing works, you don't notice it. It's invisible. It's just where you live, where your kids go to school, where you recover from hard times without losing everything in the process. When it doesn't work, it touches everything. Every single other thing. So that's what we're getting into today. Not just the numbers, not just the policy levers, but the real question underneath all of it. What's actually getting into the way of solutions? what's already working that we should be doing more of, and what has to change if we want a system to serve more people than it currently does. Which, given that it currently leaves half of renters' cost burden, it's a pretty low bar, but I think we can clear it. So let's dig in. Today's guest is Eve Toth, Housing Stabilization and Street Outreach Manager at Community Action Program, Belknap and Merrimack County. Since stepping into her current role in 2019, Eve has led a dedicated team working on both sides of the crisis, supporting individuals experiencing active homelessness, as well as those at risk of falling through the cracks. Her work focuses on meeting people where they are and helping them navigate a path towards stability, which makes it very important that she is a terminally optimistic person. So let's get into that conversation. Thank you so much for being here, Eve.
You're welcome. Happy to be here.
Do you want to tell us a little bit? We're talking about the housing spectrum today, from homeless to very well off in a lakeside mansion, right? There's a full spectrum of housing. Mm-hmm. And do you want to tell us a little bit about how CAP works into that, or maybe a little bit about your role at CAP and how you play into the housing spectrum?
Sure. So I manage the housing stabilization and street outreach departments at Community Action Program of Belknap and Merrimack counties. And our team is a specialized team of people with lived experience. My team is entirely made of lived experience individuals. So some of us are people in recovery. Some of us are people who have experienced homelessness. We have folks from all walks of life. We have veteran representation. There is somebody on our team that any participant could genuinely connect with, and that's really important. Because we are a team of social workers focused on carrying people from housing insecurity to housing stability. And that's a big part of why we're the housing stabilization department and not just the homeless outreach or street outreach department. Because our goal is to take a person who's, probably going through the worst event of their life, or one of them, and take them, back to a place where they've been able to put their life back together and able to access society in the way that we all enjoy as people who are housed.
Yeah. How did you personally get started in this realm? What's a little bit of your story getting into this work?
Completely by accident. I had the privilege of meeting my director, Beth, in an interview. I had lived experience. I had experienced unsheltered homelessness at age 19, about to turn 45 now to give context. And that happened while I was a college student right here in New Hampshire. Every advantage afforded to me, just a series of unfortunate events that led to the volley of housing insecurity and unsheltered homelessness. My situation was brief, which is how it should be. I figured things out rather quickly and was able to bounce back to a very successful career in sales and sales training and as a district manager in the wireless industry. But when I left that field, I kind of didn't know what I wanted to do. And after having gotten laid off, it was actually an employment counselor, which is a resource that many of our participants utilize, that made the suggestion to me. They looked at my resume and saw that I had a lot of personal service and volunteerism, and they said, "Why aren't you a social worker?" Literally, that's all the lady asked me is, "Why aren't you a social worker?" And I said, "Well, all I've ever done is taught people how to sell stuff. I don't think they would have me."
Yeah.
And that got me thinking. So I started applying for jobs that were in that field. At first, things like managing call centers to source donations, things like that. But I happened upon this job that was for a homeless outreach worker at Community Action Program of Belknap and Merrimack counties on Indeed, and said, well, I went through that. Maybe I can help some people, and put in my resume, and it was literally, that was it. I had my interview and got to meet my boss, and pretty much the almost 8 years later, I'm still here and very pleased with what I do for work and how much we've taken this program and how many people we've supported back to dignity and stability.
Yeah. So you've been working here. You've been working at CAP for 8 years,
Yeah,
and so
close.
over that time, you've seen a lot of changes.
Oh yeah.
And because I mean, 8 years ago would have been 2018. So
Yeah, I started February 25th of 2019 to
okay.
put a pin on it. So I'm about halfway through my 7th year, and then the pandemic set in.
That was going to be my thing of like, take us from when you started through the pandemic to now we're post-pandemic. What are some of the changes you've seen along the way in housing instability and the housing spectrum? And
Yeah, well, I think if we can be grateful about anything regarding the pandemic, it's that we all got creative. We all started to innovate. When I started at Community Action, my department was 2 people. It was myself and my director. And there were no other outreach workers. Since then, at the national level, housing instability and unsheltered homelessness have been highlighted as a result of the pandemic. And for the first time, there is some focus on not only dealing with the issues that revolve around unsheltered homelessness, but there's a focus on housing stability and preventing the things that lead to housing instability and inevitably unsheltered homelessness, and treating those symptoms of poverty before they're rampant. So. And I think that's something that Community Action is really genuinely good at. We have 70 programs. My department is just one of many. Everything from Meals on Wheels to WIC to
all sorts of things.
Food pantries. I mean, we just do it all. Head Start and Early Head Start, the list goes on. And I think that's what I'm most grateful for, is I've seen us go from a department of just a couple of people trying to help people stay safe to a department that has grown to, oh boy, I want to say we're 8 or 9 people strong now.
Oh wow.
Are supporting the 2 counties in a very measurable way. We support I want to say 18 people in permanent supportive housing, which, we case manage them. We took them from unsheltered homelessness all the way to that dignified and housed space again. We have several families in our rapid rehousing program now, and we're working with probably close to 150 people on any given day who are actively unsheltered, moving towards their goals of housing stability. So we get a lot done with, don't get me wrong, we're very grateful for our tools, but we make do with the bare minimum and produce some really impressive results.
In a nonprofit world, that's really what you have to do sometimes, is you take what you have and you see how many lives you can change with it. Right? When you first got started, did you have any personal goals? Because you had lived through, right? You have lived experience. And so did you have a mindset going into it of what you wanted to accomplish through the role?
Yeah, I mean, I just wanted to give people options, and I think if I have any superpower, it's conveying genuine intent and being a good judge of people. I taught people how to do sales interactions for a long time, so being able to gauge where a person is at and push myself out of my own comfort zone is just part of what I do day to day, and kind of always has been professionally. So early on, I did my best to figure out what skills were transferable and how I could use those skills to share in the most appropriate way possible my lived experience, so that I could build rapport with the people that I was there to help, and to help people move forward. And in as positive a way as possible is say, hey, listen, we all know what it feels like to, or at least I knew what it feels like to maybe be in some of their positions, although you can never fully understand because all of us experience things like homelessness, housing instability, general poverty differently. Especially depending on where you're from and what your support networks are. But I quickly learned that building rapport and making those connections with people was what was going to get the job done. And being able to convey genuine intent and create an atmosphere where people don't feel judged and they're not worried about talking about their experience with you, which is hilarious because I have no clinical background. So using my own personal experience recovering from my experience with being unsheltered and just generally being poor as a young adult and the struggles myself and my spouse had, taking those experiences and again using them to convey empathy for the things that the people we serve are going through has been really valuable and has helped us connect. And I think we've built a culture on my team of connection.
Yeah. I love how you mentioned empathy in there. I think empathy is super important in any issue, but specifically this one, right? Like I think that is one of the things that is missed most often in this conversation of everybody is going through housing instability, homelessness in their moment with their emotions, and there is a whole line of story that leads up to the moment that you see them on the street or whatever it is. And I think a lot of times people just look over that whole history, right? The barriers that they faced along the way, the challenges that they tried to overcome, because very rarely does someone just like wake up when they're 5 years old and say, you know what? I want to be homeless. That's what I want to be when I grow up. That's where I want to go. Yeah. Right? It's not often that you hear that from a 5-year-old. Yeah. And there are so many systemic issues that line up to bring a person to where they are, right? And I was wondering if you could maybe kind of touch on some of the barriers and the systemic issues that people are facing in housing instability, specifically if you want to go New Hampshire, National, Lakes region, however you want to talk about that, because it's different everywhere we go, right? Everybody is individualized in their experience, so there are different barriers that everybody faces. But what are some of the common barriers that people are facing right now?
Well, geez, I mean, poverty, the symptoms are clear. They've really bubbled up to the surface these last few years, and I think, hopefully we'll be able to pivot as a collective of communities and as a state. Hard to say what will happen nationally. That's not really my place, but, I think as a state, New Hampshire cares, and New Hampshire is a solutions-driven place, and I definitely think that the Lakes region is a solutions-driven place. All the partnerships we have up here are really strong, and it's a continuum of care that really aims to get it right and to not reinvent the wheel, but to use the wisdom that's worked in other places and replicate those successes. I think, generally speaking, people are just getting priced out. I think that we need to really aim for the low-hanging fruit. When I was growing up in the early 80s, you saw a lot of multifamily homes being converted back to single-family homes. I think we really need to start seeing the other thing happen again. I think we need a resurgence of rooming houses and single-room occupancy dwellings. These types of opportunities give young workers the option to not leave our state. To have shared housing is not a new solution. You know, so I think these are ways we can combat the rising costs of living. Obviously, our state is trying to build its way out of a housing crisis, and I find that admirable. There are a lot of amazing organizations doing great work, like New Hampshire Housing and Finance and Authority and the Housing Action New Hampshire. Just so many great organizations doing wonderful advocacy around on getting the right type of housing we need in New Hampshire. But I do think there's a lot we can do with the housing we already have. To answer your question about barriers, the number one group of people experiencing homelessness, the group of people growing experiencing homelessness is 55 plus. It's also the group experiencing homelessness for the very first time. So they don't have any of the skills to survive that level of poverty. And it's producing really bad outcomes. People who have never had to stay in their car or pitch a tent in their entire life are now thrust into situations where they literally don't have shelter. These are people that, by my experience, often have worked. While they've not had careers that have afforded them great wealth, they have worked. Maybe they had a career in retail and then they got sick, or they were in construction and their body just won't do it anymore, or just many, many factors. I have teachers in school districts in my catchment living in their cars.
My gosh.
So it's not what I think most people have in their mind's eye. What you see on the sidewalk, while that is a face of unsheltered homelessness, there's a lot of silent sufferers that are living in their cars and park and rides, elderly folks that are living in their vehicles or are doubled up, going from one family member's couch to the next. Homelessness has a lot of faces. I think most people think of that top 3% of people. Maybe they're suffering from what we call co-occurring symptoms, maybe some mental health issues that may have led to some substance use issues. That's definitely the way I see it present. Most people don't start with the drug problem. They develop it once they start going through all these horrific experiences. So, again, low-hanging fruit. I think there's a lot we can do at the local levels. I think there's a lot our zoning and planning boards can do to make it easier for people to convert properties so that they can have more single-room occupancies and things of the like. And, obviously people like you and I, although not in my position, I'm not allowed to do any sort of lobbying, but would definitely encourage others. If affordable housing and not seeing our aunts, uncles, and grandparents get priced out of the state they've lived in their whole life, if not seeing our children move away. I have a 23-year-old that's a union carpenter, who can't afford to move out.
Yeah.
And that's a really good job, a really good job. Makes more than most social workers I know and still can't afford to buy a home. So that's deeply troubling. I think we can course correct around a lot of those things. So would just encourage people to just to pay attention. Maybe attend a zoning and planning meeting. Maybe follow one of those organizations I mentioned, like New Hampshire Housing, or follow the CAPBM social, or the Partnership for Public Health. All these organizations are doing wonderful education at the very least, and a lot of them are doing some wonderful advocacy where allowed.
Yeah. No, I mean, that you kind of touched into one of the questions I wanted to ask you about what can people do, but where I don't know if public sentiment's the word, but where do you feel like the general community opinion is at, right? When we talk about like multifamily homes, stuff like that, everything arguably comes back to like a YIMBY NIMBY debate, right? Yes, in my backyard, no, in my backyard. And with the housing, where do you feel like public opinion is standing in terms of like multifamily homes, stuff like that? Because you mentioned how in the 80s it went from multifamily homes to single family homes, and it would be very important for it to start moving back. Where are we at?
It's hard to say. I mean, my role is taking the people with the housing insecurity and locating housing for them and case managing the people through those experiences. And there's a lot of recovery involved once you've experienced that level of housing instability, unsheltered homelessness, poverty. There's a lot of mental health stuff that needs to be addressed. I know the word trauma gets used a lot, but it is a different part of your brain kind of takes over when you're unsheltered, and you really are thinking about just your basic needs and nothing else. Your ability to plan evaporates. They call it a time horizon. Your maximum ability to plan when you're unsheltered is somewhere in the vicinity of 12 hours out. I think when I look at what we need to do in New Hampshire, I think it's a blend of a lot of different things, right? There are a lot of solutions right now that are working. Permanent supportive housing works. It ensures that people have the case management they need to overcome their challenges. Rapid rehousing programs work. I think we need to bolster those types of offerings. And I just am very encouraged by all the work all of our organizational peers are doing to bolster housing stock and to advocate for housing stock. And I'm really hopeful, to your point about the YIMBY NIMBY, I am very fortunate enough to be a homeowner. And that was one of the ways that my spouse and I were able to elevate ourselves out of poverty, was owning a home and having that fixed expense where our property appreciated in value. And if we had fallen on more hard times, we could have drawn on that equity to survive a financial crisis. Your average renter doesn't have any asset like that, which even something as simple as I worked a line of work, maybe I was self-employed and was hurt. To go back to that kind of domino effect you were saying, like there's no one thing that leads to homelessness. We'll see people that maybe they're independent contractors, they're hurt on the job, they can't work for a period of time, they don't qualify for employment security checks, and in a lot of situations. And their only option is to apply with the local welfare level, and that help is limited and can be a real strain on the communities that are providing it. So you will often see people either A, not know that they have the ability to apply with the town for help when they're experiencing that type of an employment crisis or an injury or an illness that's sudden. And they slip into housing instability, and then further slip into maybe something like couch hopping or being doubled up, and then eventually they wear out their welcome at that couch they've been hopping at. No matter how good a guest you are, you're only a guest for so long. It's implied you're a guest, right? There's non-permanency there. So eventually you wind up in your car, and then your car breaks, and then you wind up in a tent. For me, housing instability was as simple as I deferred my on-campus housing and made several bad roommate decisions. It's that simple. So there is no one thing that leads a person to homelessness. It's not been my personal experience with the people I'm serving, because I think there's a big misconception that it's always mental health, it's always drugs. It's definitely not. The number one people I'm seeing slipping into homelessness are elderly and disabled people on fixed incomes. So our nans, our aunts, our uncles,
Yeah.
people we really care about. And I'm seeing a lot of people that are totally and permanently disabled, meaning they've been disabled since youth. My program and one of my supportive housing programs, we support an adult with who has adult developmental delays. And a lovely individual, but the system didn't catch them. And I met them in a tent at the time with their veteran husband.
Yeah.
He has since passed away. But it's astonishing to me how many people slipped through the cracks, and these lovely folks were a good example of that. We were able to take them from unsheltered back to housing and case manage these folks and give them their life back. Most people with the right supports are successful. I think that's really what it boils down to is resources, supports, and consistency.
Yeah. I think that's it's always very important to understand that the community that you surround yourself with, right? And having the supports, just the emotional support, the financial, the mental, any of it, just having someone to help you through, right, is huge. I told a story a while ago at some presentation I was giving about a little town in Pennsylvania, and came from a bunch of Italian immigrants who moved there, and they had a lot of the familial support systems because it was generations and generations living in housing. And so when a son lost their job, they had a family there to help catch them, support them, and let them get back up on their feet. Yeah. And through that, there was a lot of studies that were done that like heart disease, mental health, everything was better there when you had those support, when you had that community engagement where everybody was partnering in. And I've loved how throughout this conversation you've been mentioning all the other partners, right? Because it takes a village to help people, right?
100%.
Yeah, you may interact most with a client, right, at CAB or here at PPH, we might do that. But it takes a huge connection of resources. It takes a huge community input that will help that person become the best version of themselves, get to a little bit better situation. Whatever it looks like, it takes a whole state worth of resources. It takes a whole community's worth of resources. And that's why none of us can do this alone, right? None of our, public health touches everything. That's why we're connected through our organizations, right? We can't ever do it alone, and it takes us having a network of people being willing to help our community members when they fall on hard times or whatever it looks like. I did want to ask, you've kind of throughout this kind of mentioned a few different terms and stuff of like permanent supportive and rapid rehousing, things like that. Do you mind kind of defining that term specifically? And then if you think of any, love to just let's just get a dictionary going.
Sure. Yeah, my pleasure. Language is important, right? Language and our word choices are a big part of how we connect with others, and it's a big part of how we show respect for others. So, with rapid rehousing, it sadly is anything but rapid. There is the idea is that you take a person who's experiencing literal homelessness and you wrap them with supports, and as quickly as possible, you address their needs in a participant-centered way. So, an example might be if you're working with a household that is currently unsheltered, we often engage people at places like soup kitchens and drop-in centers.
Yeah.
The tent cities are where my teams work. We engage participants through our street outreach program. They're entered into something called the New Hampshire Coordinated Entry System, which is, think of it like a sorting hat.
For all you Harry Potter nerds.
There's a lot. It is a podcast. So it sorts all the people. It's like a choose your own adventure story, to date myself, and it decides which path people needs to walk down and helps us as social workers identify what the right fit is to help this person move towards their goals of housing stability. So the coordinated entry system is triage. It's vulnerability scale that helps sadly categorize people based on their risk of having something awful happen while experiencing homelessness. And through those risk factors, we're able to filter people towards their best chance of success.
Yeah.
That can mean a lot of different things. We work with a wide array of people. But one of those many things that the coordinated entry system filters people to is rapid rehousing programs and permanent supportive housing programs. Rapid rehousing programs work with unsheltered people to give them opportunities for case management, sometimes rental assistance, program to program. It can vary the type of monetary support you get. A lot of it has to do with our budgets. We stretch our dollar just like they do with the market basket. And really try to be good stewards of the public funding we receive. We take it really seriously because it's a privilege, and the more effective we are with the funding we're provided, the more people we can help. So we will help the person find a new unit. We will case manage the person through any factors that may have led to them becoming housing unstable in the first place. Often that has to do with accessing benefits that they didn't know they were eligible for, or helping people access career training and other types of employment benefits, so that they can regain their dignity through the workforce. That's very important to a lot of my participants.
Yeah.
In fact, most of my participants, it's very important to, which I think is a common misconception. People like to work. People need purpose, So rapid rehousing is really designed to address those things in a person-centered fashion, and we always hope it's fast, right? But there are a lot of precipitating factors like trouble locating units that meet the federal cost requirements. We're only allowed to put a person in a unit if it meets certain pricing requirements, and here in our wonderful state, as wonderful as it is, we all know there's a cost of living problem. We all know rents are not what they're supposed to be. And if you don't meet those standards, I can't move a tenant into the unit. So often there's a bit of a logjam with locating a unit that meets the pricing standards. I have seen some movement from the pandemic through now in addressing some of those issues, which gives me hope. I like to stay positive.
Yeah.
If anything, I'm terminally optimistic.
I love that term.
Nothing's permanent. And even if it gets worse, eventually it does get better. So permanent supportive housing, rapid rehousing has a time limit. That's the big thing that separates those two programs. The other thing is rapid rehousing is available to pretty much anybody that's been unsheltered and meets those risk factors. Permanent supportive housing has a higher bar for entry. A person must be what we call dedicated plus. They need to have a verifiable disability under the Americans with Disabilities Act and need to have experienced a length of homelessness that is defined as chronic homelessness eligibility. And that's a specific length of time having experienced unsheltered homelessness, ensuring that the absolutely most vulnerable and highest risk members of our society are able to gain access to the level of case management that they need to be successful with their long-term housing. So that's kind of permanent supportive housing in a nutshell. It's everything that rapid rehousing is, but designed for the most frail of our community, and designed to support them with no time limit until we can find them a permanent destination where they will be safe and stable.
My gosh.
Whereas rapid rehousing, the longest I can serve a person is for 2 years, with a third year of case management but no financial support.
Interesting.
My program, due to budget reasons, we typically only offer about 3 months of financial support for the rapid rehousing program and 24 months of case management. We find reserving the funds that way, we're able to serve more people.
Yeah.
And give a lot of people a fair shake through good case management at getting back to work or getting those benefits they need to pay their rent successfully, or applying for an apartment that has an income-based rent model so that they can afford it on their fixed income.
My gosh. There are so many little things that I just didn't think about.
Yeah.
Right? But when we talk about the spectrum of housing, there are so many things in there that just fall through the cracks because they're not on one of the extremes.
Oh yeah,
right?
There's more rules than the tax code when it comes to programs like mine. I mean,
my gosh.
We are very strictly regulated, which I'm very fiscally conservative, so I appreciate that. But, to your point, there's a lot of moving pieces.
Yeah. No, there's so many little things there that I would feel oftentimes so overburdened of just like having to know all of the regulations, having to know all of that. I don't know. I feel like if I were in your shoes or trying to help someone, I would just be like, I don't know how I can even get started. But I'm so glad there's someone like you who's terminally optimistic and like always looking to help, right? And having an organization out there like yours doing this, being one of your many programs that you offer, right? Before we go, is there anything what right now, being a terminally optimistic person, this can be at CAP, this can be in your personal life, but what gives you hope right now?
Well, I'll leave you with kindness is free. It doesn't cost us anything to be kind. So, I see moments like that in the community all the time. I recently had a private donor find out that one of our participants was moving into housing. I didn't even house them. It was just, a community partner housed someone. The participant worked with us while we were unsheltered. While they were unsheltered, we worked with them through that experience, and they were selected for a housing opportunity. Someone found out they needed bedding, a bed frame, and a bed, and donated that. So, random acts of kindness give me a lot of hope. People choosing to kindness through their language, taking those mindful pauses. I think there's a lot of people that we get to work with every day, both you and I, that are wonderfully collaborative. I'm really grateful for all of the support we have. I work very closely with the Bureau of Homeless Services, and between entities like the Bureau and the Partnership for Public Health and all these other, the community mental health centers I work really close with. It's the net that everybody's always saying doesn't exist. Well, every net has holes in it, but the net does exist, and it is functioning, and it's made of tremendous and resilient partnerships. So that's kind of my
Yeah.
toxic optimism, or terminal optimism in a nutshell is the people that make all the links or pieces of that net are what give me hope.
Yeah, there's always holes you can fall through, but trying to make sure, because no net is perfect in the world of nonprofits and government agencies, right? So it's figuring out how do you move the net to make sure you catch someone before they fall through a hole, rather than just pointing out there's holes in it, can't use it. No, there's good parts of the net that we can use. Where could someone learn more if they have questions or thoughts, right? Where could someone learn more about what you do, what your organization does? If they have questions, where could they point those to?
I would encourage people to visit our website, which is www.capbm.org. You can check us out online, Community Action Program of Belknap, Merrimack Counties. We're on Facebook, @Cap Street Outreach. There are a lot of great organizations that do advocacy work. I encourage folks to sign up for the Housing Action New Hampshire newsletter, your own newsletter. I pay a lot of attention to. And last but definitely not least, the National Alliance to End Homelessness is a really thoughtful organization doing a lot of great policy work. We've had the opportunity, my director and I, to go speak at the national level, and they're doing so much great policy and advocacy work. But what I think is most important is they're doing so much work in education, where we social work professionals have the opportunity to educate one another and share best practices and successes with one another. And I think that's probably the thing that gives me some of the biggest bits of hope. But yeah, I would encourage people to check out the National Alliance, the CAP website, and just all the community partners in the area. Get involved, sign up for some newsletters. At least it'll be spam that you learn something from. So
just what we need right now. It's useful spam.
I'm telling you, it's either that or shoes and cosmetics. So either take my money or learn something. I choose learn something.
I like that. And I think that's the perfect note to end on. So thank you so much for being here, Eve. It was so great having Eve on the podcast today. It brought up a lot of thoughts for me. First and foremost, it really emphasized to me that the people on the street aren't the only people facing homelessness. The people that we walk past every day, that is one small pocket of people experiencing homelessness. There is a wide spectrum that people get put into. And the other part of the conversation that I found very interesting, mainly because the nerd in me pricked up, was how there is a sense of the sorting hat when you're talking about rapid rehousing. But it really brought to me a different picture that the whole housing in general can sometimes feel like a sorting hat, something that you don't get to necessarily choose where you're put into. The system gets to choose it for you. And I think that is very interesting because it is based off of so many different aspects of your life from the start to wherever you are in it. If this conversation brought up any thoughts or hard conversations you would like to have, that's the point. That's why we're here. Subscribe and follow along. You can find us online at pphnh.org or on our socials at pphnh. Better Together is a partnership for public health production. It is written by me, Tessa, and Emma, which is how it is both informative, witty, and somehow a work of art, all in one podcast. Our producers are myself and Emma Peterson, with technical direction from Tessa Donahue. Thank you for being here, and we'll see you next time.